I'm Jonathon Kreutner, and this is a presentation on bipolar disorder. In this presentation, I'm going to discuss what bipolar disorder is, how it affects people, who can get it, if there is a cure, what treatments are available, and how we can help these people. What is it? According to the National Institute of Mental Health, bipolar disorder is a brain disease. Bipolar disorder, a disorder in which a person alternates between the helplessness and weariness of depression and the overexcited state of mania. Bipolar disorder, also known as manic depressive illness, is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out daily tasks. How does bipolar disorder affect people? Mayo Clinic says this about the disorder. When you become depressed, you may feel sad or hopeless, and lose interest or pleasure in most activities. When your mood shifts to mania or hypomania, less extreme than mania, you may feel euphoric, full of energy, or unusually irritable. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Episodes of mood swings may occur rarely or multiple times a year. While most people will experience some emotional symptoms between episodes, some may not experience any. Who can get bipolar disorder? Everyone is at risk for bipolar disorder. Risk is much higher if you have a direct relative who has the disorder. If one parent has the disorder, the risk is high, but if both have the disorder, the risk is much higher. It is most common to get the disorder in early adulthood, between 18 and 25, but you can get the disorder from a little kid all the way into your 40s and 50s. So, is there a cure? The short answer is no. However, there are many ways to deal with this disorder. Even though there is no cure, there are many ways to treat the disorder, and most people are able to live normal lives with the disorder. There are many medications and treatments that are successful in keeping bipolar disorder from running someone's life. So, there are two main ways to treat bipolar disorder, and they are used together: medication and therapy. Medication. A doctor may prescribe a medication such as lithium, but trial and error is how doctors decide what medication to use long term. Finding the right medication or medications for you will likely take some trial and error. If one doesn't work well for you, there are several others to try. This process requires patience, as some medications need weeks to months to take full effect. Generally, only one medication is changed at a time so that your doctor can identify which medications work to relieve your symptoms with your least bothersome side effects. Medications also may need to be adjusted as your symptoms change. Medication is a huge way to help with bipolar disorder. Not all drugs work the same on individuals, and some have side effects. Also, it is very common for a patient to only use the drug when in a state of depression, and then chooses not to use it when in a state of extreme happiness. This is not how these drugs work, however. A patient must keep taking the medication no matter how they feel. Finding the right medication is not always the easiest, as Mayo Clinic quote stated. Therapy, support, and counseling is the main therapy that is used to help people cope with bipolar disorder, in addition to the medication they are taking. Three main ways of therapy: cognitive behavioral therapy, or CBT, interpersonal therapy, and social rhythm therapy. In cognitive behavioral therapy, you examine how your thoughts affect your emotions. You also learn how to change negative thinking patterns and behaviors into more positive ways of responding. For bipolar disorder, the focus is on managing symptoms, avoiding triggers for relapse, and problem solving. Interpersonal therapy focuses on current relationship issues and helps you improve the way you relate to the important people in your life. By addressing and solving interpersonal problems, this type of therapy reduces stress in your life. Since stress is a trigger for bipolar disorder, this relationship-oriented approach can help reduce mood cycling. Social rhythm therapy is often combined with interpersonal therapy for the treatment of bipolar disorder. People with bipolar disorder are believed to have overly sensitive biological clocks, the internal timekeepers that regulate circadian rhythms. This clock is easily thrown off by disruptions in your daily patterns of activity, also known as your social rhythms. Social rhythm therapy focuses on stabilizing social rhythms such as sleeping, eating, and exercising. When these rhythms are stable, the biological rhythms that regulate mood remain stable too. A combination of medication and therapy through trial and error will help the patient cope with the disorder. Sometimes it takes a lot of time to find a way to help the patient cope, but through perseverance by the patient and doctors, most may live a normal life. Even though there is no cure with medication and therapy, the effects of bipolar disease can be minimized. How can we help people who have this disorder? Many people have bipolar disorder. You may know someone who has it, whether you know they do or not. Remember, it is not their fault they have this disorder. Treat them like normal people and do anything you can to help them. Encourage them in the process of finding ways to treat the disorder. There is a lot of info about this disorder on the internet. However, you must make sure to be wise when looking at this and know that different websites will tell you different things. If you think you or someone you know might actually have the disorder, you should seek medical help and talk to a doctor. This concludes my presentation on bipolar disorder.